Thanks for listening to today's episode of Medical Device Global Market Access by Pure Global. Today, the host will explore one of the most significant and high-volume device categories in American medicine: hip and knee replacement implants. Joint arthroplasty, the medical term for joint replacement, remains a cornerstone of elective surgical interventions, profoundly impacting patient quality of life. The sheer scale of this market is highlighted in the American Joint Replacement Registry's 2024 report, which analyzed an incredible 4.3 million hip and knee arthroplasty procedures performed across United States hospitals and ambulatory centers. This demonstrates the registry's expanding coverage and the procedure's prevalence. Breaking down the numbers from the 2024 report gives us a clearer picture of the market landscape. Primary total knee arthroplasty accounts for approximately half of all cases documented. Meanwhile, primary total hip arthroplasty constitutes about one-third of the procedures. This distribution largely reflects the high prevalence of conditions like osteoarthritis and underscores the long-term durability and success of modern implants in addressing degenerative joint diseases. Data from the Agency for Healthcare Research and Quality, or AHRQ, confirms that knee and hip arthroplasties are core operating room procedures nationwide. Beyond the high volume, the market is currently shaped by several key trends that manufacturers must watch. We are seeing a definitive shift in the care model, with a significant trend toward shorter lengths of stay in hospitals. In many cases, these procedures are moving entirely to outpatient settings. This transition has major implications for device logistics, sales cycles, and post-operative support. Technologically, the field is also advancing rapidly, with a rising adoption of robotics to enhance surgical precision and the increasing use of cementless fixation components in suitable patient populations. Another critical trend is the changing patient demographic. Historically associated with older populations, we now see younger patients increasingly seeking joint replacement surgery. This is driven by a desire to maintain active lifestyles and a greater confidence in the longevity of modern implants. This demographic shift influences device design, material science, and marketing strategies. As we look toward 2025, the combination of high procedural volume, robust outcomes tracking, and these evolving technological and patient-driven trends confirms that hip and knee implants will remain one of the most dynamic and important device sectors in U.S. healthcare. If your company needs assistance navigating the regulatory complexities of the U.S. or other international markets for orthopedic devices, please check out Pure Global. For more resources, check the description for links to our free AI tools and database. Thanks for listening, and we'll see you next time.